resistance is the silent force driving weight gain, fatty liver, inflammation, and diabetes. It's also the hidden reason some people can't lose weight no matter how hard they try. So what really is insulin resistance and what can we do about it? This over here represents a muscle cell, and over here is the pancreas. That's the organ that makes insulin. The red ribbon represents the blood vessels that carry nutrients, hormones, and substances throughout the body. We'll focus here on insulin and glucose. When we eat food, it breaks down into sugar, which travels in the blood. But the sugar cannot enter into the cell by itself. It needs insulin to help it enter the cell. The pancreas releases insulin. This ball represents the insulin. Normally, the insulin only needs to make one knock on the door of the muscle. One knock, the door opens easily, and the sugar can enter the cell. But in insulin resistance, the muscle door is stuck. One knock is not enough. So the pancreas has to work extra hard and release more insulin. So they can knock on the door, knock, 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 and eventually, with enough insulin, the door finally opens. Knock, 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 and finally, the sugar is able to enter the cell. So this is insulin resistance. The muscle cell is resistant to the action of insulin. The door doesn't open easily. So the pancreas keeps pumping out extra insulin to compensate. This means that the level of insulin in the blood is high. Now let's see what happens in the fat cells. Fat cells are different. Their doors open easily. So just one knock is always enough. The sugar goes in easily. The fat cells just keeps getting bigger to accommodate the sugar, and eventually we add more fat cells for the extra sugar. That's how weight gain happens. And this is the liver cell. The liver door is always open. Sugar can easily move in and out of the cell without insulin. But when the insulin level is high, it tells the liver to take in extra sugar and turn it into fat. And this is how we get fatty liver. Fatty liver is actually very dangerous because it can turn into cirrhosis. Fatty liver is the #1 cause of cirrhosis at this time. Insulin resistance also damages the blood vessels themselves. The smooth lining inside gets rough and sticky. Sugar and cholesterol start sticking to it and cause inflammation and hardening of the arteries. This raises the risk of high blood pressure, heart disease, and stroke. At first, the pancreas works extra hard, making more and more insulin to keep the sugar under control. But over time, it can't keep up. The beta cells that make insulin just simply start wearing out. And when about 50% of the beta cells are gone, the pancreas is basically out of order. That's when sugar starts piling up in the blood and you get diabetes. So what can we actually do to reduce insulin resistance? Well, if we eat too many refined carbs and sugary foods, the pancreas has to release much more insulin to handle the sugar load. Foods like white bread, pasta, pastries, and candy make the pancreas work overtime. Cutting back on those and instead eating more lean proteins like chicken, fish, or eggs, as well as fiber-rich vegetables gives the pancreas a break. Also, if we add healthy fats like olive oil or nuts, that helps stabilize the blood sugars. Also, regular exercise is one of the most powerful ways to improve insulin sensitivity. When muscles contract, they open the door to allow sugar to enter so they can use the energy. Great options include brisk walking, biking, and swimming. In addition, certain supplements can help improve insulin sensitivity. Cinnamon helps cells respond better to insulin. Chromium strengthened insulin's ability to bind to the receptor. And berberine activates pathway inside the cell to improve sugar uptake. Finally, when lifestyle changes are not enough, there are medications. Metformin improves insulin sensitivity in muscles. GLP-1 drugs like semaglutide and the dual-action tirzepatide reduce appetite, promote weight loss, and by doing so, they make the body far more sensitive to insulin. Insulin resistance may be silent, but it's not unstoppable. Small changes today can open the door to a much healthier tomorrow. Thank you very much for watching. Please make sure to leave a like and subscribe for more videos like this. This is not medical advice. See you in the next one.